Hi, everyone. Welcome back. Dr. Drew Ramsey here. I want to talk about how to find a good therapist. This is a complicated subject. There are a lot of different ways that people can get credentialed or licensed to be a psychotherapist. That's a talk therapist, someone who sits in a chair like this and listens to our mental health challenges and helps us in our journey. I think getting into therapy is certainly one of the things that has helped me achieve success in this life and really engage in the things that are meaningful to me. And I've seen people with a lot of different backgrounds, and I realize there are a lot of questions around how do we find a good therapist. So I want to talk about the different types of training that people can get. The first disclaimer is that therapists really range in quality and in training, and so it's important to do some research, but also what's really important is fit and experience. Seeing someone who is really, you feel, engaged with you and gets you, and also listens very well, but has good training, that's usually the best combination. So let's talk a little bit about how to get that training. So let's talk doctoral degrees. Psychiatrists, those are individuals who have 8 years of training in general after college, so 4 years of medical school. And then an adult psychiatry residency is 4 additional years of training. Psychiatrists do a lot of different types of therapy, but often they're known for prescribing medications. And a lot of people like myself do both. I probably spend most of my time doing psychotherapy, talk therapy, but I can also prescribe medications. The other doctoral degrees in the mental health field are PsyD and a PhD. These are doctorates in psychology. So they're not able to prescribe, but they have 6 to 7 years of training. A little bit difference in these degrees. PhDs, again, in general, tend to focus on more kind of research and learning statistics and testing, psychological testing. And PsyD degrees tend to be more clinically focused. Now, that can really vary. A lot of us, get into your, let's say, PsyD and decide what you really love as research. So again, it's important to think about the individual you're seeing and their background, what they have done in terms of experience clinically in the past. Another way that people learn to be psychotherapists, although this is a less traditional path, is through becoming a nurse practitioner. Nurse practitioners have advanced training and have prescribing privileges for some medications, but some nurse practitioners also train in programs that teach them some of the essentials of psychotherapy, and many nurse practitioners go on to complete training in talk therapies. There are also individuals who have gone on and gotten a doctorate in nursing, a DNP, and so these are individuals who, again, have significant training, often in prescribing, but sometimes also in psychotherapy. All right, at the master's level, there are a number of different qualifications that people can get. You can get a master's in social work. These traditionally are individuals who practice a lot of therapy, and probably one of the largest groups of therapists in the country, and really one of my favorite groups. Social workers are very, very functionally and action-oriented. Many social workers also go on afterwards to get additional training in things like IFS or CBT or psychodynamic psychotherapy. So again, really understand something of the background and training of the individual you're seeing. There are also a number of master's level degrees now, specifically in mental health therapy or in psychology or even school counseling and school psychology, a number of ways for individuals to learn some of the essential skills of listening and helping people through talk therapy. Another master's level degree that qualify individuals to do psychotherapy is an LMFT. This is a master's level degree that focuses on marriage and family therapy. So individuals who really have specialization in helping families sit together and discuss issues, or helping couples in their relationship or in their marriage. So if that's what you're struggling with, or you think that's maybe a good place for you, look for an LMFT degree. So those are the individuals, for the most part, traditionally, who've practiced psychotherapy, but there are a few other groups that I think are important to mention. The very first time I saw a therapist, the individual had gone to divinity school and then afterwards done specialty training in counseling and college counseling, and was very helpful to me. So you could see someone in your church, perhaps. Also, there are individuals who get doctorates in education and go on to, for example, do psychoanalytic training or psychodynamic psychotherapy training, or go to a program that specifies in school counseling. So again, understanding someone's education and background is important, but I want everyone to hear there are a lot of different ways to become a therapist or a counselor, and what really matters is experience, fit, and good training. I hope this information helps you sort through all the therapists out there. I'm Dr. Drew Ramsey. Make sure and subscribe below, and check out my website. I've tried to have lots of downloads for you to help you in your mental health journey. All the best. See you soon.